Doing very well here, Neil, and you?
Good. Today's topic: if you have gestational diabetes, what happens next? What happens if glucose challenge results are too high?
Well, uh, the value that you want to have is less than 140 milligrams per deciliter. If your test runs between 140 and 200, then you need to go on to the next step, which is a 75-gram load. But if your screen is over 200 milligrams per deciliter, then you are diagnosed immediately with gestational diabetes.
What is a fasting test?
The fasting, the step two is the fasting test and the 75-gram glucose load. There are three ways you can get diagnosed with diabetes on that test. The first one is a fasting test, the second is a 1 hour, and the third is a 2 hour value. A normal value for testing for a fasting test with on this level is a 95.5 milligrams per deciliter. Higher than that is an automatic glucose diagnosis of gestational diabetes. Then you'll get if you have that, then you'll get the glucose load to drink. And again, if your second blood draw is over 191, after your 75-gram glucose load, you have diabetes. If your 2 hour test is greater than 162, you have diabetes. So you can get diabetes in one of three ways in this test.
What are the risk factors for gestational diabetes and why is it important to screen for them?
Being older than 35, being overweight, ethnicity, Aboriginal, African, Asian, Hispanic, South Asian, Native American, and Native Alaskans have a high risk for diabetes. Family history, polycystic ovarian, corticosteroid use, previous pregnancy with gestational diabetes, and a large baby, more than 4,000 grams or 8.8 pounds. And that's kind of surprising to me, but that's what Mayo Clinic says.
What if you have gestational diabetes?
7% of women who are pregnant will have gestational diabetes. And the first phase of treatment is a healthy diet and gaining the right amount of weight during pregnancy. Getting enough exercise is really important. And if that doesn't work, then the next step is insulin.
How is your baby's well being monitored during pregnancy if you have gestational diabetes?
Ultrasound is a really good way, and that's what I would say 100% of providers would do. You take regular measurements for fetal growth and amniotic fluid levels, and again, those will be done with the ultrasound exam.
What happens when your pregnancy is done?
There will be a follow-up uh, repeat glucose tolerance test anywhere between 6 weeks and 6 months postpartum.
What are your recommendations for delivery?
Sometime between 38 and 40 weeks. However, you like to get these babies out because they tend to be big, but the problem is their lungs don't mature as quickly as a baby who's not in a sugar bath. So you might have some trouble with breathing, babies breathing. Also, these babies get a sugar bath. So they are subjected to a high level of blood sugar, and their pancreases are really busy trying to overcome the high sugar load. And so at birth, these babies are making massive amounts of insulin. So as soon as they're not in the sugar bath, their sugar drops. So have to follow them carefully.
Should you breastfeed your baby?
Well, absolutely. That's really the treatment of choice. So, and of course, it helps you get back to your normal pre-pregnancy weight.
Can I take melatonin in pregnancy?
Yes, it's considered
Metformin.
metformin. Yeah, it's considered the first line of oral treatment, but oral treatment is not really what we want to do for pregnancy. So, Yes, years ago when I was just a resident, we would not have thought of using metformin. And then, of course, it was okay for a long time. Now, there are people who say that there's a risk for small babies when they're born and for childhood obesity. So, those are the reasons not to use metformin. The other thing is, of course, metformin crosses the placenta, and that's probably how you get the small babies.
Can you take glyburide in pregnancy?
Well, glyburide is another method of it's an oral glucose lowering agent, and but it is not the first choice. It isn't even as good as metformin.
What is the best way to manage blood sugar levels in pregnancy?
The treatment of choice, the best way is insulin, and that's because it doesn't cross the placenta. Baby makes his own insulin. So it is the best way to manage high blood sugar in pregnancy.
Do I have to check my blood sugar if I have gestational diabetes?
Yes, we recommend 4 times a day, fasting, and then after meals.
The GLP-1 receptor agonists are very popular today. Do you have recommend them for the use during pregnancy?
Well, if you watch TV for an hour, you're going to hear lots of stories about GLP-1 receptor agonists. They're so popular. Now, it's a magical weight loss. I know people who have lost 100 pounds on these things. What they do is cause your pancreas to make more insulin. So the straight answer to the question is no, I don't recommend them for pregnancy. There's no mileage on them for one thing.
What is the best time to check your blood sugar after you eat, and what should the value be or a good control?
1 to 2 hours is considered the best time to check after you eat. And again, this test is done after you eat, not before you eat. The target reading should be less than 100 milligrams per deciliter for people who have diabetes. For people without diabetes, the blood sugar level should be below 140 milligrams per deciliter.
All right, the best place to go is world.allen.com and pick up Pregnancy Your Way.